It's Mari McInerney here from Croaky at the International Medical Regulation Conference in Melbourne, and I'm talking to, and would you be so kind as to pronounce your full name for
Sure.
me?
Dr. Humayun or Hank Chaudhry.
May I call you Hank?
Yes, please.
Thank you. And you've just taken up the position as
Chair
of
the International Association of Medical Regulatory Authorities.
And so coming out of this conference here, what are your big priorities?
Well, this has been a phenomenal meeting. We've had 500 attendees, so we've learned quite a lot, and a lot of good ideas have been shared. Not all those ideas are applicable, and some of those ideas have unintended consequences that we talked about just a bit. So I think as I'm about to head into our first meeting of our new management committee, which is the organizing body for this organization, it's grown now from 8 to 12. We will be looking at how best we can stay engaged with the world's medical regulators, whose primary mission is to protect the public and to promote quality healthcare. Not an easy task. We have different resources, different laws, both laws within countries and international laws that we'll have to contend with. Our own resources are limited, but we'll try to do what we can to meet some of those needs, or as many of those needs as we can.
I wondered if you seemed to question the idea of risk-based regulation and whether you were signalling a little bit of a change of direction here.
Not really. I mean, we don't really have a formal consensus statement on risk-based regulation, to be honest. We've had it discussed a number of times at our meetings, but as I heard it during this meeting, there's still some good questions about how best one applies it. So it's not a slam dunk in terms of a black and white issue that's unequivocal. I think there's still some areas that people need to explore to avoid those unintended consequences. But at the end of the day, we have to look out for the public.
But what were the things where you said we're not quite ready probably to take on yet?
Well, I think some of the science and the outcomes is still lacking, for instance, and sometimes it's important to sort of be ahead of the science. So as you saw, IAMRA just passed a resolution by all of its House of Delegates in support of continued competency. Some of the data or outcomes from that are only now beginning to emerge. For instance, revalidation in the UK is not yet done. But perhaps by next year we'll have more data. But there's enough compelling data to move forward, and that's acceptable even in public health. You can move forward with compelling data. You don't always need definitive final data. Sometimes you can wait forever for that to occur.
That's interesting you raised that. So you have a public health background. How would that inform your leadership of this body?
Well, I think public health is what this is all about, isn't it? So whether you're a doctor or not, ultimately anything we do impacts the public, and making sure there's public engagement, lay member involvement is going to be absolutely critical as we move ahead. How we do that is another matter, and we'll have to explore that.
What are the issues there?
Well, I mean, we can use technology, but technology doesn't reach everyone, and different regulatory authorities have different means of reaching out to the public, but definitely if you're going to look out for the public, they have to be engaged and involved.
Excellent. You have to rush to this meeting.
I do. Thank you.